Test, test. 1, 2, 3. Testing. 3, 2, 1.
and grateful for the part each one plays in serving and transforming the communities we serve. In your holy name we pray. Amen.
Amen. Join me in the pledge.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Says no, and if that's the case, there being a quorum present at the call meeting of the Board of Managers, I'll now move into our public hearing, which is agenda item 4. And Robert, would you like to introduce the topic?
You bet. We have done this before. This is due to our IGT capabilities that we have with our public and our private and not-for-profit colleagues. We provide them an ability to, in essence, tax themselves and be able to receive federal funding. I want to also mention that this system this year has gone exceptionally well, with Daphne sort of leading that and guiding us through this process. She's worked with the area hospitals and she's worked at what their needs are. And so what you have here, Mr. Chair, is the beginning of the public hearing. And I'll turn it over to Daphne, but I will compliment Daphne on the work that she did on this. A lot of effort, and I appreciate it.
Thank you, Robert, and I'll just give it back over to our chair, and he'll run through his talking points in connection of calling the hearing to order.
Okay, excuse me. As Chairman of the Board of Managers, I open this public hearing today at 1:15, as required by Chapter 298B, the Texas Health and Safety Code, to consider only the following issues. One is the amounts of any mandatory payments that the Board of Managers intends to require a provider participant to make for the remainder of fiscal year 2021, and how the revenue derived from those mandatory payments is to be spent. All citizen comments will be in accordance with the following. Each person who wishes to address the board must have sent an email in accordance with the requirements of the public notice. And each speaker will be limited to 3 minutes for comments. And I understand that there's no speakers, and there were no emails from any individuals wishing to speak at this public hearing. Therefore, we'll close the public hearing at 1:16. And then I'll now move to item 4B, which is consider a proposed resolution to modify the mandatory provider participation assessments for the remainder of the fiscal year 2021, and how revenue derived from those payments is to be spent under the Tarrant County local provider participation program. Each of you has been provided a copy of a resolution prepared by the General Counsel with the recommendation of the President and CEO for your consideration, which would be approved on the posted agenda items 4B. And if there's any discussion regarding the proposed resolution, I don't see any, so if not, I'll entertain a motion to approve the resolution.
Mr. Chairman, I'd like to make a motion. I move that the Board of Managers of the Tarrant County Hospital District, based on the recommendation of Robert Early, President and CEO of the Tarrant County Hospital District, and with the advice of Daphne Walker, General Counsel, approve the resolution that, number 1, authorizes the collection of a mandatory payment from each institutional health care provider located in the hospital district. 2, authorizes the use of funds collected through mandatory payments for the purposes specified in Chapter 298B, Texas Health and Safety Code. And number 3, modifies the amount of the mandatory payments for the remainder of the fiscal year ending in 2021 at 6% of the net patient revenue of an institutional health care provider located in the Tarrant County Hospital District's geographic jurisdictional area as set forth on Exhibit A.
Okay. Have a resolution. Is there a second?
Second.
Second by Dorothy. Any discussion? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. And I'll now move to item 4C regarding authorization of the President and CEO to make intergovernmental transfers, IGTs, from the Local Provider Participation Fund. And I'd like to entertain a motion for that authorization.
Mr. Chairman, I'll move to authorize the President and CEO of the Tarrant County Hospital District to make intergovernmental transfers, IGTs, from the Local Provider Participation Fund of the Texas Health and Human Services Commission based on the Executive Commissioner, the Texas Health and Human Services Commission schedule of requested IGTs for compensated care payments.
Second.
Second by Dorothy. Discussion by anybody? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. And we now go to the regular board meeting, which is item 5, which is the approval of the minutes from June 10th, 2021.
Move to approve.
Is there discussion? All in favor, please say aye.
Aye.
Those opposed say no. We're up to the board chair report, and it will start the same way that it has now for over a year, which is thank you, thank you, thank you. I can't even start to think of all the names and people that I would say thank you to. But once again, we're back meeting together, which is a big step. Second thing I have under the board chair report is there wasn't really a forum to say goodbye to all the residents that are now going out into practice. And I hope that what they've learned and what the new group will learn is that once you get that diploma and you go out the door, there's nobody watching your back anymore. It's your game, so please use your wisdom and take care of people. Hopefully cure suffering, take care of the sick, and God's will, stay healthy. And also I'd like to welcome the new group of, we've gotten rid of the term interns, I hope. So it's a new group of residents. I guess they've been here, what, 2 weeks?
Yeah, about that, 2 weeks.
Good. And I hope they take every second that they can to soak up whatever knowledge they can. I'm personally against the 80-hour work week, but that's another topic. But I wish them all well.
That's right.
And the,
You need to talk closer to your mic, they can't hear you.
oh, that's fair. And let's see, the last thing I have is, I've asked Zim Zimmerman to chair the Quality Committee. I may not be able to make a number of meetings, so I've asked him to step in. Steve, you had earlier told me that you were pretty busy in your practice, so I really appreciate that. And I think that's all that I have.
Thank you, Mr. Chair. CEO report, make sure that you all keep your cell phones on, because I assume before the end of the day, each one of you will receive a thank you call from the CEOs, thanking you for what you just did for the IGT payments, and thanking all those institutions in town for all the increased funding that you've provided them. I'm sure that that is definitely in order, so make sure you keep your phones on. Just keep your phone on. The other thing I wanted to mention, you know, we have had, as we put in cultural changes and initiatives and we enact the policies of the board, what we found early on in some of those changes is they would get to executive level, but it was really hard to get that down through the organization and get that down to a variety of positions at JPS. When, you know, JPS is bigger than my hometown in South Texas, and so there's, you know, over 7,000 folks to communicate with here, and we found that we were oftentimes missing. So about 6 years ago, we instituted our ambassador program. And the way ambassadors get selected is if one of your supervisors or a colleague sees you following the 3 rules, if you are owning it, if you're seeking joy and you're never a jerk, oftentimes you are nominated to serve on our ambassador group. And we have just over 400 people in our ambassador program. And before COVID, we were having conferences and development institutes with them, just like we do with our executives. And those went really, really well. But a lot of the employees at JPS are saying, we don't get together anymore. We're sad. We've got a newsletter. We do the best we can to get emails out. But last month, we put together all the ambassadors in a virtual meeting. And there is a platform called e-poster boards, which is kind of a cool platform. It allows you to move in the meeting. It allows you to sit at different places with different people that are in your room. It allows the speakers to kind of be at a speaker's podium. And it does the best it can in a virtual world to make it not so virtual. And we put together that program, and the response was pretty overwhelming. We had 185 participants throughout the entire day that listened to the things we were talking about. It was really a nice structural meeting, and a lot of great reviews from that. So we're going to continue that for our ambassadors. We're going to continue that for our leadership as well, for managers, directors, and up, and we'll continue to have those. The other thing that we did that I thought was pretty amazing is in Precinct 2, which is Commissioner Allen's precinct. She had a town hall meeting to talk a little bit about what was going on, the state of JPS and the bond program and those type things. Amanda Arazola and DT Nguyen were there. They presented. Both of your two colleagues represented you exceptionally well and did a good job. What I thought was interesting amongst a lot of things that were there, and I thought I gave a lot of accolades to Commissioner Allen because I thought she did an excellent job, but she did ask the question live, on a scale of 1 to 5, how would you rate JPS and your experiences at JPS? That's challenging when you're just sitting there. You think, well, how's this answer going to come across? And what was great for Amanda and I and DT was something that we were not surprised about, but it was validated. When asked the question, are you very satisfied? 50% of those attending said, I'm very satisfied with JPS. When asked the question, are you more than satisfied, 12% said they were more than satisfied, 32% said they were satisfied, and 6% said they were partially satisfied, and not a single person attending the conference said they were not satisfied. So to you board members, we talk about the challenges here and we raise those challenges. It was nice to get the affirmation in a public setting. Randomly asked a poll question of what they thought about JPS, and it came back very responsive. Wanted to also let you know that the new position that we created, I've had Jill Farrell in here, and I've introduced you all to Jill Farrell. Jill will be handling up a lot of our case management and a lot of our population health and putting focus on it. And what Jill and her team are doing is they're getting together with our communications team. If you're a patient at JPS, you're going to receive a packet of information. It's going to tell you how to navigate. It's going to give you phone numbers. It's going to help you through the process of JPS. But interestingly enough, we had not specifically done that for our connection patients. Connections patients were not getting here's the step-by-step to going through the process. So proud of Jill and proud of our communications team. We will share that with you when it's completed, but we're probably 2/3 of the way from completing that project to give our connection patients one more opportunity to understand how to navigate through the system. We will continue to have updates on our Yes to JPS website. Amanda has played a role in that in helping our communications team, making sure we're reaching folks. We now have some things that will be updated constantly on that. So occasionally you all can go to that Say Yes to JPS website and you'll get updates on there. We're trying to make sure that we are updating for our vendors, making sure that they understand the process. Daphne and others are working on a way by which we can say, here are the steps by which you can not only be notified of an RFP, but here are the steps to apply for an RFP. Here's what is required from JPS. Those are not going to be changed. They're not 1 month it's this and 1 month it's that. So our goal is to let vendors know as directly as we can how to work with JPS and how to submit bids to JPS. And
I have a question for you.
yes, sir.
Did you put Trent's home phone number on that?
I did. We have Trent's picture, and it has Trent with a big thumbs up. We do have that.
Sorry.
So,
that's off point.
I think that will be helpful, but I think that is not only a work in progress, but it will change every month, because we're going to hear more concerns from people or more questions from people as to how to do things. The other thing that we discussed yesterday in a meeting that we had was how best can we help you as board members get a one-pager that talks about the process for an RFP, so that you can feel free that if you do in your community, particularly those of you who are very high profile in your communities, just hypothetically speaking, let's say you're a reverend in your community, and you have people that come to you every other day. In Steve, Montgomery's case, I don't know if anybody's coming to you, but in Reverend's case, you're going to have some people that might want to communicate with you. And I think it would be very helpful if we equipped you with, let me tell you the process. And in fact, I'll give you this handout, or you can go to our portal. You can go there so you're not caught in a situation, and you'll be saying the same thing Dorothy says, who obviously has a huge profile in the Como area, and Amanda, and out in her areas. All of you can be saying the same thing. So nobody can say, well, Ralph Emerson said this and Zen Zimmerman said that. We're all on the same page. And it's all straightforward, and it's all legit, and it's all open, and it's all as clear as day. So I think that will help you all. So with Daphne's help from the legal side and communications and just putting it together, we're going to put that together. Trent and I mentioned that yesterday, which we thought would be hugely helpful just to give you guys an idea. So, Mr. Chair, that is my report. I'm happy to answer any questions, but that's my report.
Questions?
I have
Amanda?
3 kudos, actually, for JPS. And
Can you
speaking-
turn up your mic a bit? Get it
Okay.
close. No, I'm just kidding.
I will,
I'm just
I
kidding.
will. I'll make sure. I'm all like, this is going to come out real well. No. So every time I enter and exit the parking garage, they're always fantastic.
Mm-hmm.
And the last couple of times I was here back to back for committee meeting and then other meetings. And she just wanted to say she was so excited to be a JPS ambassador. She was looking forward to the meeting. That's the time that she looks forward in seeing other people. So I just want to give kudos out for that particular program. Then a couple of Saturdays ago, I was here with my sister, unfortunately going through urgent care, emergency room, everything else. Beautiful woman at the McDonald's. I know they're not always our employees. I tried to talk about that. But the embodiment of the spirit of giving and helping was really, really sweet there. I'll tell y'all, it was silly. It was one of those mornings, my credit card was doing something weird, and I just wanted some coffee, and she pulled out her cell phone. I got a coupon for you. I was like, and so it's just, she doesn't know who I am,
Right.
what walk. I was looking a little rough because it was early Saturday morning. But that alone tells me what she's doing for other people and the people who come through JPS all the time. So I think that that's really important for us to be able to highlight as well, that even our contractors understand the spirit of JPS and that we're here to heal people and to help and support people in whatever capacity that means. Lastly, I want to give a shout out to the communications team because I was talking to several people. How many people know we got a podcast? I'm all like, the podcast is actually really fantastic. So if you have not, it's ending up on season 3. It's individuals, administration, all over staff, and the podcast is really great. So if you got a long commute like I do, because I'm back and forth in the car all the time, it's easy to put on and easy to highlight. So I want to give communications team, everybody who works through from that, being able to share that out. I think that is one of the ways that we're able to get our message out to the community as well and let them know that we are a top-down all the way through organization.
Super. Amanda, thank you very much. We
Yeah,
appreciate
great.
that. The podcast is going to feature Mark Hallman and talk about where JPS needs to look as it looks towards the future and what we as a staff need to do, what board needs to be thinking about, and what the community needs to do to sort of look at JPS for not only answers, but questions as well. So you will hear Mark eloquently talk to you about some of the needs that JPS will have, and I think he did a great job. So give you guys an idea of that. Amanda, thank you very much. That is appreciated. And in all likelihood, you spoke to Cynthia down in our parking garage, because she is just fantastic. And she is, and that you can see why she's an ambassador. But you know, everybody down there, we have a gentleman named Trushit, some other folks. I mean, just incredible people that do incredible things. And I always talk about the fact that those people are taking in carbon monoxide all day long, and they smile at you every time. Yep, it may be. Yeah, it may be. But they are an amazing group of people. I'm always proud of our parking team. So, Mr. Sheriff, if you don't mind, I'll introduce our next.
Go right ahead.
As you all know, what we do each month is we provide a segment for you all in the listening public to get an idea of some of the intricacies of JPS. At board meetings and even at committee meetings, you may not know all the details of all the things we're doing. It's challenging. It's a huge organization, and certainly our public will not. So each month we bring you a clinical, and then we offset that the next month with a non-clinical area of JPS. These are designed to give you and the public an idea of what goes on. The team leader, the folks that make things happen down there, is headed up by Christy Nguyen, and Christy is with us today. You know, sometimes there are a few board members that will ask me not to compliment so many people so much of the time. Really just two members of our board right now.
Are they over there?
They are over there. They're looking at each other. But I'm going to refrain from any comments they may have to tell you what an incredible superstar Christy Nguyen is. And Christy and I were on she may not appreciate this, but Christy and I were at a conference not long ago, a virtual conference. And Christy couldn't be at work that day because she had to deal with some health concerns of her own. But the conference started at 6 o'clock, and Christy was at the conference. And she's pretty amazing. And what she does in med-surg is nothing but Herculean. If you ever are down, spend a little time with Christy Nguyen and the med-surg team, and you'll realize what an incredible place you all are board members of. So, Christy, if you don't mind, give us an idea of what goes on in med-surg and go through that process, and thank you for being here.
Thank you for inviting me. So good afternoon. Like Mr. Early said, I'm Christy Nguyen. I'm the Med-Surg Executive Director. I've been with JPS for 4.5 years. My leadership team includes 8 managers and an administrative assistant. I don't know, do y'all have my slides?
Your slides should be, there you are. There,
Okay.
Can you not hear her?
Yeah.
Yeah. She is, but, yeah, no, you wouldn't have heard anything.
Yeah, danger, danger, danger.
Okay, awesome. Okay, so in med-surg we have 172 beds and we have 9 units. Out of those 9 units, 5 of them are medical surgical beds and 4 of them are medical tele beds. And so this just breaks down like our different managers and the scope that they cover. So our goal in nursing is to prevent patient harm as well as give excellent care. And this past year has been very challenging with COVID. It's been very challenging with COVID. So we've had a significant increase in our quality outcomes during quarters 1 and 2. As y'all know, with COVID, we had sicker patients, and with the donning and doffing, getting into rooms in a quickly timely manner was a little more complicated, as well as staffing. But our team worked together on an action plan, and we initiated what we call a back to basics in educating everyone, what do we do for falls prevention, HAPI, CLABSI, CAUTI. And our quality nurses also worked very closely with our travel nurses, agency, as well as our seasonal nurses to help us during this time period. So you can see in quarter 3, we've made significant improvements in our quality outcome. So year to date, we had 5 CLABSI, 5 CAUTIs, 18 HAPIs, and 3 falls with injuries. With our medical surgical staffing, 71% of our nurses are bachelor's prepared, 10% of our nurses are going back to school to get their BSN, and 4% are continuing their education with getting their MSN. 23% of our nurses are certified, and proud to say our longest tenured nurse here has been here 36 years, which is quite amazing. We have several nurses who've been here 30 plus years, so to me that's just like, wow. Our average tenure of nurses is about 15 years on the floor. We have a strong shared governance. One of the biggest initiatives they're working on is staff retention. We have the Sunshine Committee, we have peer-driven recognition boxes, we do Employee of the Month, Employee of the Quarter. The team leads share positive comments during the huddles, and we try to get that initiated by the team leads, that way it's not always coming from the leadership team. We also have thank you cards we send out. On some units, they send out welcome gifts to help welcome the new employees coming in so they feel like they belong with their team. And per employees' request, we also looked at doing cross-training in critical care just to get them to that next skill level. So one of our biggest challenges in med-surg is staffing, but our team knows this is not just an issue at JPS, this is like a national issue going on. We've had nurses who left to go do travel nursing. The good news is a lot of them said they're coming back when they finish their stint. We also had a lot of nurses who retired earlier than they had planned to due to COVID. But we've been utilizing travel nurses, seasonal, as well as PRN nurses to help fill our gaps. For employee engagement, I'm very proud to say we've been a Tier 1 division for many years in a row. We have a strong shared governance, unit-based council, as well as task teams. Anytime we ask, we have nurses who step up to help us out with whatever initiatives we're working on. As a leadership team in med-surg, we also do quarterly rounds for staff appreciation.
What does Tier 1 mean?
When you're looking at your employee engagement, they rank them from like Tier 1, Tier 2, Tier 3. Tier 1 is like the best in terms of ranking.
Tier 1 is going to have a lot of indicators such as retention of employees. You measure morale by, timeliness, who's coming in to work. It pretty much looks at a variety of outcomes to see if you're hitting those marks. And Tier 1 is not easy to get to, but we luckily have far more Tier 1 than Tier 3s. And what we started doing is taking our Tier 1s and pairing them with our Tier 3s to try to help them out.
In terms of recognitions for this past year, Tower 7 was recognized as being first place at JPS, as well as in the nation, so that's pretty amazing. We had 4 DFW Great 100 winners. We also had a Gold Stethoscope winner. Towers 9 and 11 were recognized in the Texas Organization for Nursing Leadership, Heroes in Healthcare Video, so that was pretty cool. The staff really loved seeing that. Some of our leadership team within med-surg was also recognized at the Texas Organization for Nursing Leadership and the Texas Board of Nursing newsletter for helping out in the kitchen during snowvid. So that was pretty amazing to be recognized in the Board of Nursing newsletter. But that concludes my report. Do y'all have any questions?
But snowbid, I haven't heard that term.
Well, it's
I
the
like that
big
one.
snow day where a lot of us stayed here during that week to help out because we were here 24/7. We did go help out, making sure people got bed assignments as well as rounding on the floor to make sure staff was okay. And then we found out that the kitchen was really short-staffed, so a few managers and I went down there to help prepare patient meals, pass meals out on the floors and stuff. Because we're a team. If they're short, our patients aren't getting food, so we all jumped in to help wherever. And it was pretty cool because one of the professors I work with, Dr. Polonian, did a feature and asked, "Can I use your picture?" And I was like, "Sure." And the next thing you know, Texas board calls and they said, "Hey, we saw this article. Can we use your pictures?" So I was like, "Sure." So it was pretty amazing when you get nurses calling you saying, "Hey, normally you don't want to be in the Board of Nursing newsletter, but we saw y'all." But it was pretty cool because JPS got the recognition too because it says, leaders from JPS did this.
Congratulations.
Thank you.
Excellent report, and from all the outstanding things, I know what it takes to get there, so you're doing a wonderful job, so thank you.
Christy and her team, obviously in a med-surg unit, you're going to really get challenged by COVID patients. And I want to remind you all that there was a time when we were over 200 patients in beds with COVID. And there's a lot of talk right now about the variants that are out there, and what are you doing for Delta variant, and what are you doing for this? The number one thing to deal with variants is get vaccinated. And I think many of us who are vaccinated assume that everybody is vaccinated, and unfortunately, that's not the case. And it's time that many of us who have been vaccinated and have the luxury of not having COVID need to be very loud about the need to be vaccinated. And I realize that there are some that are going to have some challenges with that, but Christy is one person that's seen COVID up front and personal. And so when you see it that close and you watch people dying, it's no longer a political issue. It's an issue of life and death. So please, let's get vaccinated and help the med-surg people and folks like Christy who have to go in those rooms and put themselves at risk to help others who oftentimes are not taking the steps to help. So Christy, thank you very, very much.
Yeah, well done, Christy. Thank you.
Our numbers have not increased to any spike level, but we have today 20 people in beds with COVID, and we were hovering at around 8 and 9. So our numbers have increased. I wouldn't, Dr. Duncan and I would not call it a spike, but the numbers have increased in the past 2 weeks from, like I said, from about 8 to 9 a day to 20 or so a day. We get asked a lot of questions. Are you testing for the variant? We test for COVID. We're not able to go through a lot of a variety of that, but it's really, and this variant will potentially be followed up with another variant, Again, the key is back to the basics. Realize what you need to do, vaccinate yourself and your friends, and for those percentage of people that just don't want to get vaccinated, it's time to speak some hard language to them. Not cussing language, Reverend, just tough language, tough stuff. He looked up quick at me.
What took place here does this take place of Nurses Week?
We tried our best to do Nurses Week, and we had it. We had to have some things that were virtual, but we had a lot of things in the hallway. Instead of grouping people, we went to them. Wanda and Dina and the HR team did a lot during Nurses Week, but we had to cancel, like the function that many of y'all spoke at. We had to cancel those type, and our Nurse of the Year and Employee of the Year, we had to cancel those. But we still try to do these as much as we can. We're going to the individual floors now. Mr. Chair, I think that's it on my list. Dorothy?
Are the COVID patients being admitted vaccinated, or is that following the trend like everywhere else? Okay.
Yes, ma'am. It follows the trend. It's a mix. We're still seeing those. We haven't seen in Dr. Duncan, correct me if I'm wrong, we still are seeing people that are coming in, but the trend really follows the trends in the community.
We are starting to see some vaccinated employees, in fact, test positive, requiring hospitalization as well as illness. We are seeing some of that in vaccinated individuals.
Okay.
But at this point, it still is predominantly the unvaccinated. So, thank you. Appreciate it.
All righty. Next thing I have is Roman numeral 9, JPS Foundation Report. JR Lab.
This report is a new feature to your board meetings. Chairman Weber and Amanda Arazola thought that this would serve you all well. Amanda, of course, is our liaison to the foundation board. And it's probably good that the board get a more of an update and a go forward about what are we doing at the foundation and how are we doing it. So JR is going to give you a basic review of that. And then depending on how you all receive and want this, we'll figure out what we do at future meetings. This is not a one-time deal, but we'll try to figure out to what extent you all want this information and how helpful it is to y'all.
To be here today, to have an opportunity to provide you with a briefing of what's taking place in current time down at the foundation. Of course, we exist to solely support the network. It's scientific and educational research, it's charitable activities, support for our team members and our patients, and it's been a delight to be down there. I thought I would start by talking about money, which is always a good thing. So this is impossible to see, and I am sorry about that. But on the top row of our balance sheet for this year to date, the foundation is holding a significant amount of cash assets, upwards of $4.5 million in cash and short-term cash. So at the recommendation of Sharon Clark in the Finance Department and the Foundation's asset manager, Holt Capital Investments, are managing our assets. The Foundation Board approved the recommendation to move $500,000 from our temporarily restricted fund cash balance and $1.5 million from our unrestricted fund cash balance to Holt Capital to invest in long-term investments. And those align with the JPS Foundation's investment strategy, which is what you see there. Equities and fixed incomes are where Mr. Holt is placing those, and you can see the minimum and target maximum for how much money is in both of those. Mr. Holt's track record in managing both our short and long-term investments has been good since he started that work in 2018, when the Foundation Board at that time hired him on as our manager. The Foundation's net investment income year to date is $450,000, which is $329,000 more than what we had budgeted for this year. So he is doing well by us and the network.
Steve, he's a Longhorn.
I'm sorry?
He's a Longhorn.
Of course he is. Do you know, JR, that the, I love that, thank you for it. Did you hear that, Roger?
I was just thinking it'd be triple if it was an Aggie, so.
Sorry, Terry, you got caught in this little.
It's okay.
At least he wasn't from Tech.
I've been,
So,
been watching it every month from home, so.
So, do you, you know, the cash we have for the hospital, because we're a public facility and it's taxpayer dollars and all these kind of things, is pretty, you know, pretty conservative in terms of what we can invest in to return while we're not using it. Is it, we're not similarly restricted on this, do you know, with the foundation?
I do know that Mr. Holt has all the money that are in sort of multi-market fund type things, and none of them are in any individual fund. But I know that they've gone through with Sharon, and I'm so glad to see her walking up here at this moment.
It's just easier to answer it for everybody. No, the foundation is not subject to the Public Funds Investment Act. So he's got some stocks and bonds.
Okay.
Yeah.
Thank you, Aggie.
You bet.
Thank you, Sharon. I appreciate you being here. You have no idea. So that was done this month at our meeting. Up next, I'm grateful to talk to you about something on the grant front. JPS has entered into partnership with Tarrant County Public Health to be awarded a sub-grant from the Centers for Disease Control and Prevention that are all related to COVID-19 health disparities issues. And those types of things that have been uncovered in the community through COVID, how healthcare organizations can address those. Tarrant County Public Health received $27.2 million from the CDC. Most of that money they are using for programs of their own, but they approached us to apply for some competitive grants to programs that we are going to be doing here that align beautifully with the strategic plan that you all have approved. We asked for $1.5 million, we got $1.4, and we're fighting over the last $96,000 at this point, and we hope we will receive those. Our money is going into 3 different buckets. There is a program for a health equity plan, a JPS action plan, and transportation vouchers. I'll drill down just a little bit so you get an idea of what each one of those are. The health equity plan will work to reduce health disparities and implement processes to address social determinants of health using evidence-based strategies. This reflects the opportunity to address strategic imperative number 3, and that is for JPS to be a leader in the areas of access, healthcare equity, and outreach to those individuals who have historically been denied care. You can see that our director is Marietta Daja, the project manager is Adalia Perez. There will be a group working with her, but that is $500,000 over 2 years to help build this program. It does include funds that could be used to bring in consultants and people to assist them in that work, but we're very excited about that opportunity. The JPS action plan is going to be overseen by Joy Parker in Community Health, and her project manager is Laura Keller. The action plan looks to build community capacity to reach disproportionately affected populations in our community. Our aim in the strategic imperative 3 is to establish and strengthen relationships across the communities we serve to better understand embedded cultures and the trusted places for sharing information about health. Establishing and strengthening relationships across all communities that we serve helps us at JPS to work collaboratively to reduce community-level health disparities and improve outcomes. So this is all about community outreach and getting into areas that we are not currently in and using these dollars to create that action plan for what is being addressed in Strategy 3. And the final bucket is a transportation voucher partnership. And both clinical integration, Jill Farrell, and behavioral health, Zia Luba, are working on this together. These transportation vouchers, and they are with Metro, Trinity Metro and Uber Health, will address the transportation barriers that we hear repeatedly that are keeping JPS patients, and particularly those with underlying chronic medical conditions, from accessing care. As an example of how these vouchers will be used, the transition coordinators who are working on our FY21 depression remission goal are identifying JPS connection patients who are not picking up their prescriptions because they can't get there to get them. The Uber Health vouchers and the Trinity Metro vouchers will help knock down those barriers to be able to make sure those people get care so they maintain and manage their chronic conditions so they don't get to the point that they have to be hospitalized. These vouchers can be used across the house for JPS patients who need to get to or from access to health care at JPS locations. So it's not like they can use them to go to our peer organizations down the street or across the highway. These are specifically for JPS. And we're excited about the opportunity that this is going to provide to take a barrier down that historically we have heard about and I'm sure you were aware about. The last item I want to talk to you about is an interesting use of employee giving funds. So our employee giving program generally brings in about $300,000 a year annually. These are individuals who sign up for our hospital program and they have money taken out of their paychecks every 2 weeks. Money goes into an unrestricted funds bucket and we can use them where we see greatest need or what serves our patients. Approximately 1/3 of those funds, or $100,000 every year, we designate to support network requests for innovation or capital projects. For example, last year the foundation provided support from those employee giving funds to purchase 2 high-low exam beds for our Diamond Hill Clinic. They purchased a colposcope for our sexual assault nurse examiners team in the emergency room. And they purchased a vision tester screener that was requested by our JPS pediatric clinic. Those requests totaled about $45,000 last year. This year, the foundation board was presented with the opportunity to purchase a multi-passenger shuttle bus in FY22 that will be used to transport team members during our weekday rush hours. So in the morning and the evening, when team members are trying to get to and from the parking areas to their assignments, we have help for them on the campus. Right now, we have 2 7-passenger vans that are not ADA compliant, which is a challenge because we do have team members that need help with that kind of transportation. As every one of you knows, parking at JPS is an ongoing opportunity for improvement. Still the spin doctor. With the impending changes on the main campus related to new buildings and things shifting around, parking is only going to become a more interesting opportunity in the next couple of years. We encourage our team members to park in the Morphy Street garage so patients and visitors can have access to the parking that is closest to where their appointments and their clinics are. Parking at Morphy on a bad weather day is a challenge since it is covered parking, but it's the farthest away from where anyone needs to go for their work day. It's a long haul even on fair weather days because of where it's located. Our foundation board saw the shuttle bus as an interesting way for the foundation to provide a highly visible support for team members. Not only will it right a currently inequitable situation, but it will allow the opportunity to brand the vehicle, which will say generously provided by the JPS Foundation through the Employee Giving Program. This will increase the profile of the annual giving campaign and let our team members know where some of their money is going that they so generously give to us. The board unanimously approved the expenditure at its meeting last week. The network will own the shuttle bus and be responsible for all the operational support that goes along with that. But I'm very excited about this. It has 2 wheelchair spaces on it. It has a wheelchair lift. It is 100% ADA compliant, and it's going to make a world of difference to our team members. It's air conditioned. It's got all the bells and whistles. It's great. Okay. And that's my report for today. I would welcome hearing from you as to what kind of information you would like me to bring at future meetings, what you'd like to know about the foundation and our activities and ways that you see that we might be able to support you. Amanda has been a wonderful participant in our board meetings, very engaged, and we are so grateful for her input, but I'm welcome hearing from you as well as to what you would like to see at future briefings.
JR, a couple of questions. One is, a few years back, we had the big events under the tent that were very successful.
What?
The breakfast that
The
we
breakfast.
had, sort of introducing JPS to the community. We had those that we had 2 of those events,
Right.
and they were very successful.
Very much so.
They weren't huge money makers, but they were definitely sort of community awareness programs.
Yeah. I know we did get a nice level of donations for those events. Persons wrote checks. Is that a part of that surplus that you said we had now?
Well, that's from several years ago, but a lot of the cash surplus is from the donations that we have received in the last couple of years that are to the network for COVID-related issues, cash that came in from the community supporting what we're doing. So I would say, is there money in there left from those breakfasts? Possibly, but we get new money coming in there every year.
Because I was on the president, we raised, close to $1 million one year. We did.
From the events, no, sir.
Oh, okay.
I'd be happy to give you the reports for both of the breakfasts.
The other question I have is on the grants that we just received from Tarrant County. Those categories that you have up there overlap each other.
Yes, some they do.
Okay, and so will there be some effort made to make sure that each group is talking to each group? Okay, let me tell the whole story. served on that committee, that team. I didn't know JPS was one of the recipients, though. What they did was they blocked out names, all that, so we would not be able to identify who was applying. But as I reviewed it, I kept saying, man, I hope JPS applied for some of these dollars. I kept asking myself that. So it's good to see that we did. I must have scored you high then, so that's all. But I just would hope there's some kind of way that those categories, that they are intermingling together, because they address each other, and so the money could go a longer way if we were able to look at that and see how we can work that out.
Excellent suggestion, and thank you, sir. The first meeting of all of the partners who received money from your wonderful work is next week. And I know that the public health very much wants to not only have the individual recipients make sure they're talking, but the broader picture of how are we as a community addressing these issues.
Yeah, I would just mention one entity submitted their grant, and the body said they didn't ask for enough money. Wow. So they called a meeting to up, so they're going to get a big surprise and get their request upped, so it's increased.
Didn't request enough.
JR, what is, as bond talk is really beginning to boil, what are the plans? I talked to Robert last week, I guess, or the week before, concerning the integration of the foundation into some of these preliminary, bond conversations, because we're going to have naming opportunities, and it's not so much just the naming opportunities, is that we're going to need the foundation to help us offset some inflationary pressures and whatever else. Have you and the foundation talked about that, or the foundation board talked about what's our plan going forward to begin raising money for this bond program that we're about to launch?
Thank you for that question, and we are very much interested in see where we can integrate with the bond projects. In fact, is Adam here? Because I just put a meeting on his calendar for next week to sit down with our grant people and Adam and to look at what makes sense for us to go after, whether it's not probably not going to be entire buildings, but are there wings or areas of service within some of these buildings that it makes sense to go to a foundation that specializes in behavioral health, or something that specializes in ambulatory surgical center, whatever, that there are money opportunities to do naming on surgical suites or floors, or our adolescent inpatient unit at the new psych hospital. Is there opportunity there for us to help offset some of that?
I would highly encourage, I know that this is JPS's, and certainly the foundation's first foray into these major construction projects, significant billion-dollar construction projects. There are consultants out there that specialize in this, and I'm personally of the opinion that they should have been engaged even before the bond issue was presented to the voters, but it might not be a bad idea to engage somebody now. It will make the work a lot easier on you, and also dramatically increase our chances, because I know we've only just begun to talk about the bond and buildings and everything else, but it's a whole nother world out there of fundraising, and I don't want to say that the foundation's not prepared, but it is the first time that we've been doing this, so there are the professionals out there to help.
I appreciate it very much. And so when my budget comes to you and you see money for professional services for a consultant,
every action has an equal and opposite reaction.
Absolutely. I've been asking that question for some time. Jared, can you tell the board how many staff members you have for development and how many of those are certified fundraisers?
So sure. So we have two sides to the coin. There's the development team, and then there is the grant team. So on the grant side, there is a director, and right now there are two additional people, Ashley Campbell, who oversees the Ryan White program and all the grants we get with the 4 of the 5 parts of Ryan White that we have. And then the other member of hers is Margie Blake, who's a master's level grant, post-grant award person. She handles the administration for our state and some of our federal grants. So Healthy Texas Women, family planning, some of the ones we get from the state, Mom and Baby, those are what Margie does. And your question asked me about if they're CFREs, and I honestly don't know off the top of my head, but I'll check.
Yeah.
I know they are all master's level at their education.
The grant writers, but on your development side.
On my development side, I'm a little leaner on that side, so as far as the level of their education, you're right. So our database manager is master's level, and she is very experienced in managing the donor base, the Blackbaud, where all of our information comes in about our donors. She works very closely with finance. We have a annual giving officer who is over the employee giving program. Then we have an office manager who just basically does all of the nuts and bolts. And then our director of development as well, who oversees it. We have some open positions at this time. To my knowledge, none of them are CFREs. I know one is looking at getting her CFRE.
Yeah, I agree with Roger. I think that these types of donations that are coming through need specific skill sets to be able to. These are not run-of-the-mill, hi, I know this person, let me go ahead and give you some money. That's not how this works. One of the things that I was going to talk after. Any other questions for board members, since I'm your liaison?
I just want to say I appreciate the report, and it's the exact kind of information I love to have. You know, I just look at the financials for our finance committee, but to drill down to some of the programs that you're doing is great, so thank you for that.
I had one question. I heard on the news and a report that the federal government is giving more money to work with women's, like pregnant women's, to reduce the large number of women that are having problems and dying from having babies. So is that, I heard it last night, don't know, I think the money is already available. Did not know if the county was already looking at that, but that is a program that I think that we should look at getting some of those dollars.
I'd be happy to look for a maternal mortality program.
Yeah.
All right, well, I just have a couple of questions that I wanted to bring up because I was thinking as we were looking at these, especially with the grant program that we have, the JPS action plan, looking at who is running the programs, though they are very capable, and I'm specifically looking at the JPS action plan. They're very capable individuals, but those are 2 white women creating program for culturally, linguistic, and in disproportionately affected populations. In order for us to build trust in the community, they also need to see their community working in these programs. I'm sure there'll be other people working under these programs, but as we're planning and looking at it, I want to make sure everybody keeps in top mind that we are a community hospital, that people need to see themselves in order to feel like they're part of JPS and that they're welcomed here. And in those programs, especially as we're talking social determinants of health, as we're talking about transportation, looking at that, that's very important. Always keep that top of mind. Secondly, thank you, JR, for your report. It is somewhat what I was looking for. I'm more a charts and graphs kind of person also, because I think that is important. One of the sheets that JR did not mention that's on everybody's desk today is the contributions year to date from May. I think this is important for us to look at, especially when we're looking at percentage of donations that are coming in and how they're coming in and how that development team is able to really look at it. So some of the surprising things to me on this was that public funded grants were 3%. It's an overall $1.4 million. It's $1.4 million. I want to remind everybody we're a $1.2 billion hospital. Not to say that it has to be directionally and proportionate, but we are $1.2 million. And our payer mix, for self-pay and our connections program are currently both at 17%, which makes up 34% of our payer mix, which is uncompensated care for us. So let's think about what that gap looks like. Of our $1.2 million, that's $408 million at 34% that we have to look at, that we have a huge gap to cover in. Tarrant County residents, and I say residents because everybody pitches in sales tax, whether they live in an apartment complex, whether they live in a house, and they're paying in sales tax. Gave us $800 million to do that. We need to look at the gap. So Roger, I appreciate you bringing that up. And also, we just went through COVID. Foundations were throwing money around. I think that we did have a lot of missed opportunities, but I appreciate the efforts. I think we need to look at what are the strategies that the foundation is utilizing. I think that's important for the board to know as well of how they're coming in. That's why this top sheet becomes very important. If you look at here, individual donations were at 7%, employee giving was at 16%. Our employees are doing God's work also. Everyone, top down, everything else. They should, that's why it's lovely that we're gonna be able to get them some transportation, especially as we all know the parking situation is gonna get a little worse around here. And it's hot in Texas, and then it gets icy and cold and everything else. Those are important, but at a typical fundraising scheme, and this is why I asked about the certified financial fundraisers, they're gonna know that this particular pie and wheel is completely skewed, and we need to do better. Our corporate donations are at 23%, and our private foundations are at 37%. We are a large metropolitan hospital. We are the #1 hospital in the nation. We need to be able to look at organizations, companies that are national, that have a presence here, don't necessarily have to have headquartered here, but have a presence here, that are willing to be able to come in. I think that as we looked at strategic plan and how we're moving forward, we can give direction to our foundation to be able to do that. But during these particular times, they didn't need our direction because we had already enough funding to be able to cover, we have to be able to still fundraise to cover that uncompensated care plan. So I think that's always some of the mission of the foundation, no matter whether the board directly says go out and get this, which we will be doing later on, but it does need to be able to have an overall goal of helping all of our patients at all times. So that's my main thing, and that's what I want to keep on track here in looking at that. So those contributions to date, minus the grant funding, one of the key things that's missing that I think we also need to include into the board packet is the statement of revenue and expenses. And I've asked Sharon to separate that out from donations and grants, because grants are different from donations. That's a whole different ballgame. Also, in looking at our salaries and what we raised at $1.4 million, our salaries to date were $502,000. So we're not matching as well. That's why I think that that we need to look at what that means. I'm not saying that you're doing a bad job. I'm just saying there's a lot of ways for us to improve and see where we can go and what that movement forward looks like from now on. Because we do, and I will let you know. Can you tell us also how many board members you have? I know you're building your board right now.
We have a total of 7, inclusive of you.
Yes. And how many people of color, excluding me?
There's Robert Stearns.
One. And so I haven't given my names yet because I have been doing some community work as well. And they said, well, I don't know if I want to serve on this board because JPS isn't always friendly to Latinos. We have an issue. And we want to be able to create opportunities for that. I do have some names I'll be giving, and as I'm sure that other board members do. Majority average board members for other county hospitals, about 22.
Our cap in our current bylaws is 15, and I'm more than happy to look at amendments to that.
And yes, that's the other thing I did want to inform the board. There is bylaw changes that are coming from the foundation, which we're very appreciative of, and they should be coming through, I believe, Roger, your committee as well. Am I correct, Daphne? Okay, perfect. We have a lot of work to do, folks. Well, I'm excited to be there. Thank y'all for appointing me as a liaison. We'll continue to work with the staff and move forward.
How are our board members appointed on the foundation? Who appoints them? Do we know?
Well,
Obviously, we know, but who?
the CEO of the Health Network has the final say over
him.
all board members. Under the current bylaws, the CEO did everything, and there was no, and then he or she, the CEO also appointed the officers. Under the proposed change of the bylaws, there will be a nomination process for both membership and for the election of the officers among the members of the board, and then there will be a leadership ladder. So there's secretary treasurer, vice chair, chair, and immediate past chair will serve on that executive committee, those officers of the board. So that there's an opportunity for more moving up the ladder, getting new people's ideas in. But ultimately, the CEO still selects the overall membership of the board, but with recommendations from current board members. People can apply to be a member of the board and be vetted and then presented to the CEO.
Cool. Thank you.
You're welcome.
Amanda, you gave us a lot of information, and I did like that. You went through salaries versus what you raised. Is there a dashboard that I could see that kind of gives you some ideas? Because I know you know it, but it would help if that is something that we are going to be looking at, to have a dashboard that say, this is what the normal is and this is where we are, so we can see what goal we need to set.
Yeah, and that's one of the reasons why why I encourage these continual updates, is to find out what is helpful for y'all to look at and what is. I enjoy a good dashboard. There are other examples that I can help the foundation with to be able to look at. And then the other thing is, we always have to have a 3 to 5 year look back, especially when it comes to foundational work. That's how we track progress.
Well, I appreciate that, because you have the background. I don't have that. So it helps me when I have something like that to have a reference to, so I can refer to. And I'm quite sure for the staff that would be wonderful. So thank you.
Gerald, I got a quick question. And I mean, I'm trying to figure out how I want to say this. In defense of our foundation, it has never really, from my perspective, operated as a true foundation in the sense of what the foundation does at Texas Health Resources or the Baylor Scott and Whites or whatever else. It's kind of been the catch-all, right? I mean, for lack of better words. How does the planning process go when y'all create your budget? We see the budget every year, but we don't see much more than that. And so I love the fact that there's more visibility on the foundation, because to me, the foundation is just another public relations arm into the community, into what we're doing, and really in a lot of cases into people who have just driven by JPS and said, well, there's a building with JPS on the site. What is that? That's how I view the foundation. So how does your planning process go when, you know, okay, our employee giving campaign, we need to raise $500,000 this year, or our annual giving, or your development staff says, okay, does the board need to say, JPS Foundation, in the next 2 years, we need y'all to raise $10 million unrestricted funds? Do you need direction like that from us, or does that happen in your budget planning stages?
I think it's a conversation we definitely need to have.
Okay.
I think historically, you're not wrong about the foundation.
Sure.
in that it was sort of, and the way I've described it with other people is, it was a vestigial organ.
Mm-hmm.
That if you took it away, like your molars or your tonsils, you're going to live quite fine without it, because it really didn't matter.
Yep.
I do want to create a foundation that is muscle and bone and can help. But we were cleaning up some things from previously, getting additional different people in. We never had a director of grants before that has the kind of experience. We've never had a director of grants. And now we've brought somebody on who has deep, deep bench history with with grants, both state, federal, transportation, Food and Drug Administration, the types of things that will help our patients with programs that we can bring in. That's important. But we are still, I would say, in the very young, maturing part of our ability to support this network.
Sure. Well, and look, I appreciate that, and I'm willing to help in any way I can. I do know that cultivating donors as individuals and as companies is something that takes time. It is a true science.
Right.
People think I'm crazy. Well, you just go ask Bill for money and he'll give you money. It does not work that way.
Cultivating,
And
recruiting, and
is,
stewarding donors is an art.
and
Yeah.
it has to be an incredibly professional organization. And I think we're a little bit behind the 8 ball, especially as we're coming into this bond program. And I keep going back to that because I'm hearing numbers and seeing things and sitting there going, we're going to need more money, especially when, you know, the price of wood and copper and everything else is, you know, going through the roof, and it typically doesn't go down as fast as it goes up. But I'm willing to lend a hand in any way you can. I think more visibility to us is going to be great. More sunshine is awesome. And whatever I need to do to lend a hand, I'll be happy to help.
I appreciate it. I thank you both.
JR, you just got a new mic from Jeff. Do you want to start your presentation from the beginning?
Sure, let me go back. Can we magnify the?
Exactly. Wait, one last thing that I want to let the board know is that I have been asking specific metrics, because it is for specific metrics on the donor pipeline, those kind of things, because it is a science. It's not rocket science, but it is a science in how you cultivate, how you pipeline, what your donor engagement looks like. What does that mean? What are the events that are coming in? Having strategy, even goal setting, basic goal setting. We're about to launch, everybody in the North Texas region is about to launch their North Texas Giving Day campaign, and we don't have a goal. And that's what I found interesting at our last foundation board meeting. And I think that's important that we already start looking and planning ahead. I think we're getting feet through, but I think we also need some additional expertise to be able to run that through. Matching donors is a big thing. I know a lot of small nonprofits that already have $10,000, $20,000 in match funding for their North Texas Giving Day campaign. I also feel that it's very important to work hand in hand with the other departments, especially our communications department, with the foundation. Are doing a great job. One of the things I do want to make sure and reiterate, especially when you're looking at your top sheet on individual giving, that we have to, the county that we live in is trillion lingual over. And there are individuals, donors who want to give, but sometimes it's the language barrier. So I want to make sure that, especially in our foundation work, that we have translations in Spanish, Arabic, Vietnamese. So it takes a group effort. And like Roger stated, it is a Harlequin effort to fundraise. That's why not everybody can do it. And so we want to make sure that all of the community is able to give back in the ways that they can to JPS, whether that is $5 that they found out of their pocket because that's what they have, or if that is the multi-million-dollar checks. It all works hand in hand, and that comes through. So, thank you.
Yeah, I just want to comment also on what Roger mentioned. This goes way back. But I remember your concern of being a foundation, because when Mr. Early became CEO, that was really his big concern. And I was there. I don't even know how I wound up on the board at that time for the foundation. And one of the issues was they were applying for all these small, insignificant grants, and it was costing JPS more to manage the grant than the grant funds themselves.
Yes.
And so it had that tone of just going and looking for pennies as opposed to looking for millions. And we've seen some transition and some changes over the years, and I think regardless of what we're asking for now, it has come a long ways from where it was. And I'd like to compliment him that. And then just, we've had some change in leadership. Just when we think we're headed a certain way, boom, the leadership changes. But I think that it's focused and headed the right direction. I think it's just cleaning up some areas.
Thank you, Reverend.
Thank you.
Thank you. You're welcome. I appreciate your time. Look forward to working with all of you if you'd like to. Thank you very much.
Thank you, Dr. Chair. I do, as per last month and the previous months, if you don't mind indulging me for about a moment in a verbal update. I did want to just continue to update the board on the organized medical staff quality oversight function. So as per normal, we did review the May PSI 90 report and approve as it was submitted, as well as the minutes from the Patient Safety Quality Governance Committee, as they now report up to us. We also received an excellent report from Ms. Burnside, our Senior Vice President and Chief Experience Officer in Strategy, regarding our patient experience report. It was given to the MEC, and there were some lively questions and some discussion about how to make some further improvements. We have made some improvements, but there was a dip in some patient satisfaction issues related to COVID, but those have been coming back up. And we also did review and approve our usual minutes for the Medical Records Committee, utilization review, and our consent agenda according to several policies and procedures related to medical staff. Do also want to let you guys know that we have a delineation of privilege project underway. I've made mention of it in past very briefly, that I'll be bringing more stuff through. But we do have the Hardenberg Group as our consultants. We have finally got a template for a privileged form standardized that's been approved. And individual chairs will be working with our medical staff office as well as our consultants to revise these forms for best and current practice for all the different departments. And of course, any privileges that cross departments, more than one department does them, that will have the chairs from all departments collectively decide on what that form's going to look like. So trying to improve, standardize, and make best practice. We did actually confirm from an educational perspective that we will be receiving additional training in peer review and protection and privileging updates for the MedExec Committee on July the 29th. And finally, just our many thanks to the board managers for approving our new bylaws on June the 10th. But the work continues, because we do have to now overhaul our rules and regulations. There are, with the passage of the bylaws, there's now some discrepancies between the old rules and regulations. So we are actively overhauling those, so we can't have complete and full implementation of new bylaws. So we got to fix those areas, and we've already started work on that. And we will be bringing those forward to the board as well. And that concludes my report. Thank you.
Comments, questions for Cheryl? There's nothing that we have to approve, I don't believe. Thank you. And thank the medical staff as well.
Thank you, sir.
It's hard work. It really is hard work. The next thing I have is other matters requiring board discussion, and the first is sneaking in by the back door, David Mendenhall.
Yeah, exactly. I even wore a jacket today, and I tried to sneak in, still didn't get away with it.
Whose jacket is that, David?
I can't answer that. It was at the foundation this morning.
Nice tie you have on.
Yeah, same to you. What I'm bringing to you today is a policy that we have as EC 1800, is about personal electrical equipment with cords that come into patient care areas. This is an updated policy that has come up for review. It's basically making sure we have a policy when a patient would come into one of our facilities and they bring things with them, and we have to be able to have a policy to say what we would accept and what we wouldn't accept, and what review we're going to do in case that a physician really wants that personal equipment coming with them. So that's a policy. There's nothing materially changed about this policy today. It's just some updated language to make sure we're keeping current.
Alrighty. David, think we needed a motion to approve.
Move approval.
And a second.
I'd just like to know, how did David end up presenting?
Because it has a plug, something that plugs into the wall. It says,
Sit down for that one. So no, that's a great question. So what I don't advertise is, even though I have information technology as part of my job, biomed also reports up to me. And so this is one of the environment of care policies for biomed. You got it.
I have to know the craziest requested electronic device that someone's requested to plug in it.
A personal air conditioner.
Okay.
So they bring that in and they want to plug it into one of our beds to be able to plug that in and keep cool through the night. So that was denied.
That would be me. I was like, that would be me.
David.
Yeah. Man, I'll sit back down.
I know you've given us updates before, and this is not on that item, but do we need an update of where we are, especially with all the hacks that's taking place? I was wondering, have you had a conversation with Putin to back off?
Not personally, but with a couple of his other people. Let me, if you don't mind, let me give 60 seconds on that, right? Because there's been two major hacks that have happened against the American infrastructure just in the last 60 days, right? The KESA event that happened this week and the SolarWinds attack that happened about 60 days ago, right? We are a big customer of SolarWinds, and that was a big thing that we had to go through. What was interesting about the SolarWinds attack, and if you look at the anatomy of a cyber attack that happens, in the past it's been, if I'm a hacker, I want to go after JPS, or I want to go after THR, or I want to go after Chase Bank, or I want to go after the big companies. And all of these companies, including us, have put wonderful perimeter defenses around that it's really kind of tough to get in from the outside. We test every month of how tough our infrastructure is to get in from the outside. What the hackers have been doing over the past year is going after service providers and getting into the service providers a year in advance. And when they get into the service providers like KESA and like SolarWinds, then they sit there for about 6 months very dormant. And then what they do is then they change the source code for the service provider. So they have one hack that they have to do, and then all of a sudden 20,000 customers have that same hack within moments. And that's how really sophisticated those hackers have gotten. That's what happened with both of these events that have taken down national infrastructure and key components of the United States as well as around the world. With SolarWinds, we had already been beta patching several things because of some of the relationships that we have with SolarWinds. And we were actually one of the first ones in the nation to go through that patch right before the hack happened. And so you either say, praise God that we had that relationship with them, or we were very fortunate. I'll stay with the first one, because that was a very, very good thing that we had that relationship with SolarWinds, and we were our environment was protected. With KESA, I think we're going to continue seeing these types of hacks throughout the nation and around the world, because it only takes one person that clicks on something and all of a sudden now you're affected. So thank you, that's a great question.
David, I need an extension cord in my office, if you could do that.
I'll cut one of these and put it in your office and we'll see what we can do. Great. Thanks, guys.
Thanks,
Before
David.
I get up, any other questions?
All right, we need a motion to approve.
All right, great, thanks.
Dorothy, second.
All right, any further discussion for David? All in favor, please say aye. Those opposed say no. Motion passes. Dun-dun, Mr. Chung is back.
Thank you very much for having me today. I'm here to present Medication Management Policy 600 for medication diversion and prevention. This policy essentially is up for review and speaks to our ability to monitor and provide processes in place for controlling access to any of our substances that have the potential for being diverted at any given time. Really no substantive changes to this policy other than updating a few of the language terms there. And I'll, at this time, take any questions if you have any.
Discussion? All in favor, please say aye. Those opposed say no. Motion passes.
Thank you.
Yep, thank you.
Thanks, Doug.
Next one I have is Dina Den, NR 400.
Good afternoon. First policy for review is NR 400, reporting to the Nurse Peer Review Committee. And this policy is to ensure that we abide by the expectations of the Texas Board of Nursing and Texas Nurse Practice Act to have an established peer review committee. There are no changes to this policy, only updated references and some formatting changes.
Move approval.
Discussion? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. Dina, thank you. You've got the next one.
I do, thank you. This is Environment of Care 3500 Laser Safety Policy. This is for laser safety in our operating rooms for our surgeries. This policy is to ensure that we're meeting established regulatory safety requirements when using laser in a surgery environment. No changes other than some verbiage changes, and we updated the attachments for this policy.
Move approval.
Thank you.
For Dina, all in favor, please say aye.
Aye.
Those opposed say no. Motion passes.
All right.
Thank you. What was that?
There's a few other checkoffs to go.
All righty. Committee reports. First up is Finance Committee.
Thank you, Mr. Chairman. We had a Finance Committee meeting on the 24th of June. Another outstanding,
Yes, it was.
really is outstanding.
Yes, it was.
I'm telling you, it was amazing. I could go into great detail, but
Be careful.
I just asked him if he ever got that arm out of his sling.
So we considered the May financials, and Ms. Clark is here if you have any questions. I think most everybody was in attendance. We also passed forward for the full board's consideration a couple of policy changes and several contracts, so we recommend their approval. That's all I've got.
Comments or questions for Steve? Entertain a motion to approve. No, we don't? Okay.
No.
Perfect.
Yeah.
No approval for Mr. Montgomery. Okay, Roger.
Thank you, Mr. Chairman. I'll tell you what made finance meetings so great is that I passed Steve walking out as I was walking in. So it meant that the Outstanding Governance Committee could meet and get done before 3 o'clock in the afternoon. So thank you for that, Mr. Chairman. We met as well on the 24th. I had the opportunity to introduce Colin Warinka, who will be our new Senior Vice President of Enterprise Risk Management, coming from Dayton Children's Hospital in Ohio. He has a master's degree from Walden University and his Bachelor of Arts in Sociology from the Ohio State University. I think that's how you're supposed to properly say it. We look forward to Colin starting, I think in the middle of August. I spoke to him last week. He's excited to get started, and I'm excited to have him. And thanks to Dr. Weber and Dorothy for sitting in on the interviews. We had really 3 great candidates that were presented to us, and we felt like Colin was the cream of the crop. In addition, we have 3 policies on the consent agenda. One, COM 8700, is a new policy, and then 2 are just updated policies as part of our normal review. That is all.
First is organization of the committee itself and the staff that's going to be attending and supporting those meetings, right? We lined all that out. That included our communication protocols, that included our agenda preparation and delivery, that included who we would be inviting and why for all of the specific meetings. The second big bite is preparation of board-related information. all right? That's a huge part of what we're trying to do, is make sure that we can filter and put pertinent information together in packets so that board agendas will reflect pertinent information that is backed up with staff recommendations, all of our consulting recommendations, in as concise a packet as we can, but backed up by a ton of information that's going to be on the portal. So we are trying to manage that process to make sure that nothing that comes to the board for a decision is brought onto the agenda until we have placed on the portal the information pertinent to that decision at least a week in advance. So board members have an opportunity to read through that and see that. That way, when issues do come up, priorities are discussed, every board members have an opportunity to read that in advance. If there's questions, we can answer those questions at that time. We also want to make sure that we have, by number 3, project recommendation protocols. You've already heard, and Daphne's addressed, and we'll be talking about this more tomorrow, the RFP, RFQ process, for example. What that process looks like, what that process is going to follow in terms of protocols, and then how we put that together for board recommendations. And globally, you all know this, in the past, we have not brought to the board a decision relative to whether or not we issue an RFP. We have brought the results of an RFP, we've brought staff recommendations relative to a recommendation for a prospect, but we've never brought the idea of the RFP before the board. So this is going to be a bit different with the bond program. We want to be able to look at all of our major projects, almost in an organization structure, and be able to identify within each of those projects what the pertinent RFPs and RFQs are going to be. So that when we bring those items forward, the board will not only see the recommendations relative to the specifics and the scope of the RFP, but all the information and data that's gone into making sure that we've included all of those different components into that project. So the idea is, if you're looking at this like an organization chart, right? You have a behavioral health up here, then you have all of the elements that are required for us to be able to execute the behavioral health capital programs, then all of the different levels that have to occur within that for RFPs, RFQs, recommendations, scope preparation, specification reviews, all that. So there is a mountain of data.
Whoa.
A mountain of data. What we want to do, what our committee is really pledging to do for the board is, A, make sure nothing gets on a board agenda that is not backed up by the staff recommendations, the consulting recommendations, and information that's pertinent for the board to review before there's an action item, right? That's probably priority number 1. Secondly, we want to make sure that when we get to the point that we can say project A is going to be located at X, it's going to start Y, and it's going to cost Z. We want to simplify it to that point so that board members then have input on those decisions before those decisions are made. So none of those decisions get made by staff. They certainly don't get made by our committee, but specific to what the board will review, we want to make sure we've got those big picture items addressed so that board members can look at it and say, okay, I get it. The staff is saying we should put the parking lot here. The staff is saying the signage and access piece of that project should occur here. Here's the recommendations about how that happens and when that happens. Then we have the ability for the board to say, okay, that makes sense. I want to ask a question. I want to offer input. I think we should consider changing this or this. That then gives the board the priority option of saying yes or no. And that's what we want to be able to do, is be able to put this in clear enough information, concise enough information that the agendas aren't consumed by nothing but bond-related information, but that we have significantly backfilled that portal with this information. So when the board does have an opportunity to give that input, it's informed input. And it's input where the board has said, look, I've had a chance to read the RFP recommendation. I've had a chance to read the scope. I've had a chance to read the schedule. And that information is there. So it'll be up to each board member to really do your homework when it comes to making sure that they're clear on what that says. But it's also going to be up to the board, because we're going to be very specific about this item needs board input. this item needs board consideration, this item needs board approval. That's never going to happen absent this information, this backup being present beforehand. So our first meeting was about establishing that. So
Gotcha.
our next meeting is tomorrow. So my next report will be 3 times as long as this one was. But we'll be prepared to give it to you.
I think you're gamping up.
Okay.
Mr. Chair, the other thing I want to do is, I want y'all to realize that we as staff always listen to y'all as a board, and we're directed by y'all. And we've heard the comments y'all have made is that you want to spend more time with staff. You're sad, you don't feel that you spend enough time with each other. So I wanted to remind you all that next Friday, not this Friday, but next Friday is the budget retreat.
Yep.
And I know that there's some of you would say, I'm not doing anything on Friday. Well, I've got your answer. I want you all to come in here and spend a little time with us. And I think you're going to appreciate this. Sharon, Dr. Duncan, myself, and other members of the staff have really put together a block, and we'll get that information out to you all as quickly as we can. Staff is working hard to get things arranged so you can see the agenda and the items that will be discussed. But it's going to be basically the overlay of the strategic plan, and it's the next level of the strategic plan. It's beginning to operationalize the strategic plan, just as Reverend Emerson asked at last board meeting. Is the strategic plan the backdrop for what we're doing for budget? And you're going to see that. So we're going to break it up into employees, we're going to break it up into IT, we're going to break it up into areas. And then the following week after that, we'll have the second, is it the following week, Sharon?
Yes.
The 23rd, we'll have the other budget retreat for you, which will even be a little bit more specific on some of those things after we get y'all's input next Friday. So I did want to let y'all know that next Friday, you all know it's on your calendars, but we'll have the budget workshop, budget retreat. We feel pretty good about how we've structured it. I think it will be valuable for y'all, and it'll give you a good idea as you go into the budget. The meeting is not designed to tell you whether we're going to have 18 FTEs or 2 FTEs. That will come when you actually see the budget. This is to show you the beginnings of the operations behind the strategic plan that we have so proudly worked on, and we as a group, staff and board, have come up with a heck of a document. So anyway, didn't want to let you tell that. We listened to y'all. We're happy to spend more time with you on Friday. Thank you, Zim. I see the joy upon your face.
Mr. Chairman?
Yes, sir.
Trent, a question?
Yes, sir.
Trent, on the package that comes to the board, the recommendations from staff, will there be supportive data to those recommendations so we can see
Yes.
what they use to come up with that recommendation?
We will, and we'll make it specific to each one of the different consulting groups that's providing that. For example, if it is a recommendation relative to our ability to pay for how long it takes us to gather revenues, there's going to be a Price Waterhouse component to that.
Okay.
If it's an issue related to structure or scheduling, then there's going to be a Broadus, attachment to that. So the goal is to make sure that it's not just saying, here's what we recommend. It's here's what went into that recommendation, and here's the data behind that recommendation.
A lot of work. Thank you for everybody.
Staff is working their tails off, so
Oh, I
we
believe.
appreciate that.
Well, when you said it's gonna be a lot of work, that's why Trent volunteered.
I agree.
Missed the whole meeting.
And Roger and Steve were right behind him. I thought. Okay, anything else for Trent? Trent, thank you
Yes,
very
sir.
much. Next, item 13 is the consent agenda. Everybody should have had an opportunity to read them and see them, and they've also been presented at the various committees of the board, and that being the case, I entertain a motion to approve. Is there a second?
Second.
Second from Steve. Discussion, anybody? All in favor, please say aye. Aye. Those opposed, say no. Motion passes. That takes us down to 14, which is the report of legal counsel and legal matters.
Mr. Chairman, I don't have a report today, but I do have one litigation update for close.
Gotcha. And that takes us to closed session, reconvening an executive session pursuant to Chapter 551 Texas Government Code, and we're doing that at 2:52. And how about if we take about a 5-minute break, and then we'll come back.
Thank you, Dr. Chair. As we discussed in closed session, I present to you the credentialing and privileging for June and July.
Aye.
Those opposed, say no. Anybody else have any? Oh, we're going to adjourn, but I'd like to just read you something real quick so we don't have to reveal. Live simply, care deeply, speak kindly, and enjoy the ride, and try to live a good and honorable life, so when you get older, you can kick back and enjoy it a second time.
The only thing I would add to that is when you're hugging old people, that applies.
Gee whiz. We're adjourned.
Well,